What is scoliosis and what can you do about it? I'm Dr. Brad Wolf, and I'm here to help you to see what you need to do to take care of your scoliosis. If you know that you have scoliosis, you may not know that you have scoliosis. Scoliosis is a condition where instead of the spine being nice and straight, there's a curve to the side. We don't want a curve to the side. And human beings, at least in terms of the patients that I've seen over the years, some of them have very, very minor scoliosis, and some have very, very major scoliosis. In fact, I saw somebody yesterday, he was 28 years old. He got diagnosed with scoliosis when he was 10 or 11 years old, and they opted to not have surgery. And now as an adult, he's having to deal with the consequences of that. And so he's in here receiving treatment in my office. But it gets even worse than that. I have two patients, they were twins. And at the age of 13, one of them started coughing up blood. They took an x-ray on her spine, and she had a very, very severe scoliosis in her spine. There's both a genetic and a biochemical connection with scoliosis. And so if you know that you have this, sometimes you have to take drastic measures. But for most of us who have maybe just a slight curvature or maybe a moderate curvature, there are things that you can do to really manage your body. So in the case of these twins, they got fused from the base of their neck all the way down to their lower back. Now in their particular case, that's what they needed at that particular time, because if you have consequences from scoliosis and you can't breathe, or you're having digestive problems as a result of it, sometimes more intense intervention is necessary. But the things and the principles that you can use to be able to keep your body in a better positioning, we've spoken about this, and sometimes I feel like I'm a broken record. We're going to talk about the same principles here. We want to pay attention to the spinal architecture. The body is not perfectly symmetrical, but we want the body to be as symmetrical as it can be. And when we look at the positioning of the hips, the shoulders, and the head should be nice and straight. The spine should go up the center. If your spine is not straight, then what ends up happening is the pressure from gravity coming down on your body causes a compressive force pushing down on you. That force acts like a screw, and if you were going to screw the spine down, that's what happens with scoliosis. You have to be aware of this force of gravity on you so that you really lengthen through your spine. One of the problems that occurs with scoliosis is instead of the bones being nice and level, meaning they're square, we see how these bones are square here. What ends up happening is the bones start to wedge. They start to tilt. And as they tilt, they rotate. So if a person has scoliosis when they're very young in life, as they age, if they're not careful, those curves are going to get worse. It's a condition that you have to manage for your entire life. So we want to look at the symmetry of the body. And as we've spoken about in different videos here, we use ice for inflammation. Bring the inflammation down. If you're having pain in different areas, we want to put ice on there. That helps to cool the tissue and to pull the inflammation out of the tissue. So when we're looking at one of the things that can happen as a result of the wedging of the spine is there's a deterioration process that occurs that can cause the discs and the nerves to get irritated, the inflammation to go up. And we all start down here. And if we're not careful, we start moving in this direction. A lot of times where the curve is, especially if there's a radical curve in the spine, you start to get these degenerative changes in the spine, and it's not necessarily an age thing. I've seen it in really young people, and I've seen it in older people. So the point with all this is for you to seek professional attention to be able to manage your scoliosis. It's not something that you really want to do yourself. And if you don't know if you have scoliosis, an x-ray is the easiest way to be able to see that. Now in my own spine, I get x-rays every 3 to 5 years, get a full set of my entire body. And I've actually started developing a little curve myself. So even though I've been working on my posture and working on my core and working on all these things to take care of my body, it does not prevent your body from starting to curve abnormally. So seek professional attention. Make sure that you understand about your condition so that you can take care of yourself the best way possible. One last thought for you. There was a German physical therapist. Her name is Dr. Schroth. S-C-H-R-O-T-H. And Dr. Schroth actually wrote the gold standard, the Bible per se, for rehabbing scoliosis. You can't a person who has scoliosis cannot exercise like a person who does not have scoliosis, because the muscles are contracting more on one side of the body than the other. So find out what your condition is. If you're not clear whether you have it or not, get an x-ray done, get some help, and manage this and to improve the quality of your life, improve the quality of your aging, and live the best life possible. The next video we're going to be talking about is about the dangers of spinal fusion surgery.